Oh, shit. Oh, that's it. Okay. Hello. So this is the second live Q&A. I mean, I get asked a lot of stuff as a massage therapist for more than 20 years, since 2005. If you wanted more details about my history, I've been doing massage for 20 plus years, since 2005. I have a bachelor's in math and economics I got while I was a massage therapist. Then I got a master's degree in data science. And then I also got I attempted chiropractic school, but they kicked me out for sharing lab videos online after 3 years. So I developed intense knowledge of pathology, immunity and infection, anatomy, and that's what we're going to go over while we discuss some of these questions that I get. Okay. So I'm using the Complete Anatomy app. It's really great. I think that if you have that app, you can really help yourself to heal. Healing comes from within, and massage can help you do that by helping you enter the restful state of healing, which is deep breathing, lowered heart rate, basically the parasympathetic response, which is normal sized pupils, not dilated, as well as not sweating palms, no anxiety, no racing heartbeat, pure deep breaths, letting the mind rest, letting it focus on things it needs to do, having things it needs to do, as well as being able to go to sleep and wake up energized, as well as, digesting your food so that you can feel hungry, have a desire to eat, hold down your food, and just go through the regular digestive processes. If you're in a stressed out state, you'll have the dilated pupils. You'll also have possibly sweaty hands. Your body might sweat, as well as racing heartbeat, more of like a raspy breathing, or like breathing that is forced. Quick thinking. It's early in the morning. Yeah, so let's go into it. I'm going to go ahead and share my screen. And then we're just going to see where this takes us. All right. So I think this is beneficial because it really helps promote massage therapy and how massage therapy can help us. This is the Complete Anatomy app. It's really wonderful. So this is your posture. This is what you should be doing daily. You should have your screen right here. I'm just going to, when you look at it, your typewriter should be right here when you're typing. And you should basically just walk around like this all day. But we can't. Most times we are stuck by technology, and then our head ends up being, hold on. Okay, so our head will end up being, okay, sometimes it works, sometimes it doesn't. Yes, I'll have to, okay. Well, it will end, okay, so there's no way for it to go back. Okay, that's fine. All right, there's some limitations, but it's okay. This is a great app because we can go over how our posture makes us have pain. When your head is right here, that's like 30 degrees. That's 30 pounds on the muscles, the connective tissue that starts in your external occipital protuberance right here. Your suboccipitals connect to it. Those are for nodding, yes or no, or turning slightly to the side. And then also the connective tissue to your upper traps, which connect to this spine of the scapula right here, as well as T1 through 12. Let's go ahead and we can just see. Now look, here are our so, and that's where our nerve roots come from, right here. And then the more that you are stressed and working, you also start compressing those. You have the vertebral artery that starts to get compressed. It goes over this first vertebrae right here. You can see because of the ring as it's going over this atlantodentoid process for rotating side to side. You have your first cervical nerve that right in here as it goes into the brain. And then you also have your vertebral artery. You can get headaches from that. Headaches that, let's just add we'll just add the nervous system first so you can see it. And it is, I believe it's this one. It looks so tiny. The suboccipital nerve. And then we'll add the arteries. Oh, and you can see the vertebral artery right here. No, not that one. Right there. This vertebral artery supplies your brainstem, and it goes. We can actually remove some of these processes, but you can see how a tight fascial, myofascial, or this is your carotid artery. I think it's your external. Yes, and then this, it starts to become your internal, or that's your maxillary, which is a branch of the external. But here's the bifurcation of it. All right, so we have all these muscles here. You could see that the external occipital protuberance here, where the connective tissue with your upper traps for shoulder shrugs, or when you're going forward, it can start to compress that over time. Imagine 10-hour days doing this, stressed on the third, or on the thing like that. Yeah, so it can happen. People get headaches, all genders. A nice cranial sacral massage can help with that. Let's go ahead and add some muscles. We can also add some connective tissue first. That's the cartilage. 4 types of cartilage. The first type is the nucleus pulposa. And then you have the type 2, which is like the disc material, annulus fibrosus, as well as the labral tissue and the menisci, which is a really good point too. But we'll get to that one. So you can see we have this connective tissue right here. That is the nuchal ligament. That's what the trap's attached to. Let's go ahead and add some muscles. Here's our suboccipitals. Some of them. Oh, actually, that's the deep intercostal ones. They're all in layers, so they're all connected. And then here's our suboccipitals right here. You can see that triangle. If it gets really tight, the nodding motion, side to side, upper cervicals, this artery, vertebral artery, as well as the first nerve getting compressed, starts to cut off blood supply. And then let's just look, the vertebral artery is in the back, supplies the back of your brain. That's where you get vision. A lot of people can get migraines and headaches when it starts getting compressed. Let's go ahead. Let's finish looking at all the muscles though, and how a cranial sacral massage can help. So we'll go ahead and add some more layers. Let's add another connective tissue though. So here we have our investing cervical fascia. If that gets really tight, let's look at how far that goes, covering the traps. See that? If they're really tight, let's add that muscle there. So we got our deep erector spinae in there. Let's add another one. Those are for holding up the spine. Our levator scapulae, our scalenes. Then we have another muscle. Let's see, that one is, which one was added? I think that was a levator scapulae. Oh, and the rhomboids also in that other layer. All these layers intertwined, and then we got our, that's our rhomboids right there. Because they're, oh no, that's not. That's actually the Serratus posterior. Those are like if you have really deep bronchitis and need to get more breath or cough more. Those can get really sore and they're under the rhomboids. This can lead to some shoulder pain. Massaging deeply into there, but also this fascia if it's really tight. Look how that fascia is going over this vertebral. I mean, not the vertebral artery. This is the occipital artery, so that can cause some headaches superficially. And we'll go ahead and add another muscle layer because we haven't even gotten to our traps yet. That's the top layer. And right here, that looks like the sternocleidomastoid. Also in that deep cervical fascia, all those muscles can get really tight. Let's add another one. Now we finally got to the top muscle. That's the traps. You can see how those can block off some of these nerves. Neurovascular compression. So a deep massage, also relaxation, cranial sacral massage would also help, because now let's go ahead and remove the muscle layers because we're seeing what they compress. We can actually start looking at this blood supply now. So we're going to just hide this. Let's just hide this part of the bone. And this one too, the occipital bone. And then we got here, that's the top meninge, the dural mater of the brain. Okay, let's go ahead and remove that. Hide. Here's our cerebellum, or cranial arachnoids, the covering. That's the second meninge. The pia mater was attached to that one, so we don't see that one. But here's the cerebellum. Now let's see. Here's our vertebral artery right here. We're going to go in there and see. A lot of people have a stroke, and it ends up being that this supply in pink going over that first cervical vertebrae going into the brainstem. This right here is the medulla oblongata. You can see from those 4 olives, or similar. And then you can see the cranial nerves coming out of it. Here we have the pons and the basilar artery, where the vertebral artery comes together, is going to go over this pons right here, I believe. Yep, the basilar artery. Many people get a stroke when it goes over this region if there's a blood clot, but they can fish it out by going through your abdomen into your femoral artery that doesn't have any veins right here, bringing a little wire thing going surprisingly, which is funny because they have to actually go into the arch of the aorta right here, and then they go through this either the subclavian artery and go up to the vertebral, or they're going to go to this carotid artery right here. So here's our vertebral artery. So the fastest, let's hide this bone right there, the clavicle, is going to be from the clavian artery. Now you know that because, oh, actually it is the, okay, yeah, so this is the brachioradialis, the carotid, that's the front of the brain and middle of the brain and the face. And then this is the subclavian artery. This is also where your thoracic duct empties with the lymphatic system, but they go up this femoral artery, through the abdominal artery, through the thoracic artery. It's all one artery. Aorta. It's the aorta. Sorry. So you go up here. So the femoral artery, they'll go in there through your groin. There's no valves in it. Abdominal, thoracic. They go up to subclavian artery up there, and they'll fish out a clot to save you from brain ischemia, because the brain cannot be without oxygen for too long or brain cells die. And that's what leads to that disabling effect of the body, the flexion, reflex when they get over it. And then some people can go through physical therapy and do really well. It might take some time, but That's one way that they do it. Okay. Now, let's go through this list that I have together of what we're doing, going over. All right. So let's go over that lymphatic system. So the lymphatic system, let's just go from, we'll just leave everything where it is. Okay, so what's cool about the lymphatic system is that the arteries supply blood to our body, and it's pumping 50 to 70 milliliters of blood per pump, 60 to 100 pumps per minute. That's about 5 liters of blood that goes through your body in a minute. It's very fast. It's supplying what it needs. Now, the veins don't go as fast because they have valves needed to go up against gravity. Gravity is 9.81 meters per second squared with going up against your own body. So to bring the used blood back, you usually have to pump your muscles. They even tell people that are like in the space or flight professions to, if they're going to be flying jets or whatnot, or pilots, that you have to wear compression socks or pump your calves so that you can get that blood up from here against gravity while you're seated, going up to your heart. If you run low on blood to your heart, you're going to run low on blood to your body. And that is called hypotension, not enough blood supplying your heart. That's usually lower than like, I think 80 beats per minute. No, or the blood pressure, not the beats. It's blood pressure, systolic, diastolic. I think it's maybe 60 diastolic. It's been a while, but it doesn't matter because like if you don't have enough blood going to your heart, you got chambers in your heart, and that is not going to have enough for the stretch sensors in your atria where the blood deposits from 3 veins. You got the inferior vena cava from the bottom. We didn't add any veins, but we can. All right. So we'll add the vein, and then you got the superior vena cava, and then you got the vein, the carotid vein in the back of the atrium. That's also supplying it. So we'll just add the veins, and you can see that. And there's stretch receptors that send it to the ventricle. So it goes into the right atria, the blood that goes in, and it stretch sensors say, oh, it's at a certain pressure, and drops it into the right ventricle. The right ventricle goes into the pulmonary artery supplying the lungs, and at the same time, the used blood goes into that other. So the right atria used blood, okay, coming in at the same time. The left atria is taking the clean blood from the lungs. Whenever the stretch receptors are good, they open up, let it into the ventricles, and they crisscross. So the right ventricle on the right side goes to the lungs to get oxygenated, and cleaned, and then the left atria and into the left ventricle goes into the body. Now into the body, hold on. Into the body, it comes out of this really fast. It has to be very powerful from that ventricle right here, that it goes up the aorta, up these 3 branches, the brachiocephalic to supply the right arm, and then the brain and neck and face, and then the left arm, and then the rest goes to the body and branches out. Okay, 5 liters per minute. Now, where our thoracic duct comes in is these veins, right? So the veins can only take up so much fluid. Now, if you have different injuries, like you have a cut or tissue tear, blood leaks out, right? And then you got protein waste. Protein waste, it follows the same laws of hemostasis and hydrodynamics, where if there's a membrane between 2 fluids and concentration, the fluid's going to balance out until the concentration is the same. So of the molecules. So what ends up happening is that you end up getting peripheral edema. Okay, peripheral edema, you'll see it and you'll notice it, and it'll scare you because you're like, whoa, I never had this before. Good. Well, a massage can help with that because that's where the lymphatics come in. Let's add that. Now, the lymphatic system is really interesting. We have it so that all that extra fluid doesn't lead to peripheral edema. It's also where we connect with lymph nodes, where they house soldier macrophages, B cells, mnemonic, monocytes, eosinophils, neutrophils that are ready to attack and kill any pathogens, but also fluid is transported in there. They are ducts. They have ducts. Fluid can go in there. They're usually, they say, the size of a pea. They go, okay, so the lymphatic system is actually the left side of your face and neck, and then the rest of your body. The rest of your body is the left side. And that goes through this duct right here, thoracic duct. It dumps into the subclavian vein, actually. So the subclavian vein, I think is, oh, it's actually this one right here. Oh no, is it? Yeah, that one right there. So it's the same connection, but this is where the thoracic duct dumps out. And it's a little bit different in each one. They say the subclavian vein, and the vein is bringing deoxygenated blood and waste material to the heart. Now it's bringing it to the heart so it can pump out to your lungs. Your lungs can take the waste, give it back, also make it oxygen. And then whenever your blood gets pumped out, it's going to go into the system and go through the liver. The liver is going to clean and detox it and make urine and recycle all the proteins and then send it to the kidneys right over there. I mean, I could add the viscera if it makes it useful. We can do that. And then you can see it will be the digestive tract or endocrine. This one's going to be endocrine to add the liver. So we got the pancreas. Oh, I guess not. What's going on here? All right, let's try the. Oh, it's part of the, they have it part of the digestive tract because it does digest toxins, but also some people call it the endocrine system, the liver. So we'll go ahead and remove some layers. It'll go through that system. Inferior vena cava will bring it back, branches to the liver. Whenever it's bringing it, the blood's going to the body. And then it will clean it out. It will go through its own vein into the kidneys. We'll add the, wow, so I'm at my max on endocrine, urogenital, because the kidneys are part of the urogenital system because it makes urea, urine. And there is where it filters out stuff, and it's in charge of your electrolytes. The liver is also that processes vitamin D and calciferol, and the kidneys, they both are needed for vitamin D processing, which is in the gut that we need for immunity. Vitamin D is a key component to good immunity. You need it. You need to get sunlight. Your sunlight processes 15 minutes a day, vitamin D, with your healthy kidneys and liver so that you can give nutrients to your blood and your white blood cells. Now, that lymphatic system, I only said the left side and the whole side of the body, right? Well, this other side, the right side, that's the lymphatic system on the right. It's separate and it doesn't go through the thoracic duct. Now, if you get lymphoma or metastasis, a lot of the times breast cancer women, most of the times they have lymph nodes taken out so it doesn't spread. Metastasis and lymphoma won't hurt the lymph nodes and make them grow crazy, gnarly, like a lizard is in your neck, right where the thoracic duct is, and it won't be painful. But if you had a bacterial or viral infection, some of those pea-sized things will be swollen and painful. Now, if it's painful, it's bacterial or viral. Now, that's not necessarily that much better because actually your spleen your spleen right here, that will get swollen. Now, if you're in a contact sport, it can get really huge, called splenomegaly, and you fracture your rib, boom, pop it. It doesn't heal very nicely. It's the storehouse for all the old red blood cells that last about 180 days. That's how they judge your A1C, or 120 to 180 days, is by looking at your red blood cells over time to see your hemoglobin levels. But this can get enlarged. It can rupture if you've had a viral or bacterial infection. You're at risk in any contact sport not to play that sport for at least a month, especially if you have pain here, because there's stretch receptors in here. And when it gets too large, a lot of the times it will be painful. But if you have cancer, that's a tricky one, because they say like cirrhosis, you don't even really feel pain until other processes start happening, I believe it is, or hepatitis, because it takes over and enlarges the whole liver and you won't feel it. But you got to get it treated fast, because even though the liver, you can literally donate 80% of it and it will regenerate, they say, and you'll survive no problem in life. If you get hepatitis B, you could die in like a few weeks to a month. And it's not even that common. Hepatitis A and E, I believe, and C, or D and C. Hepatitis C, everyone knows about. Yeah, you can die. That's usually from, they're all from poisonings, but the foodborne ones, I believe, are A and D. A lot of people are immune to because they have already developed an immunity. It's usually those folks that can eat food that's been out for like hours and not get sick. And then hepatitis B, that one is more from, it could be different components, I believe, but you can look it up. This is really a good refresher for all of us, right? And then yeah, hep C can kill you in a month or two. Then you got cirrhosis. That's usually from drugs like too much Tylenol that damages the liver, or alcohol, too much alcohol over time, malnutrition, hepatitis, effect of it. And so you got your thoracic duct here emptying out everything. You got your macrophages, your eosinophils, your neutrophils, basophils, eosinophils, neutrophils. Those are granulocytes, so they also are responsible in the immune system. Those are all from the bone marrow. They make that, the blood, and in the young kids, it's the long bone. In the adults, you get more metastasis along the spinal bones, because the long bone starts to turn into yellow marrow, which is fat, because the bones aren't really made for creating the red blood. The long bones aren't for creating so much of the red and yellow lymphocytes, red blood cells, white blood cells. And so we also have in the intestine, we have mucosa-associated lymphoid tissue that goes out and protects against antigens, as well as all the lymph nodes that go through there. So it's interesting with the colon, because it starts at the duodenum, coming from the stomach. That's the gallbladder, but the duodenum is really close to there. It's we might have to hide it. Okay, yeah, so it's right, I think it's right here. Duodenum. So the stomach, and then they have a pyloric valve in there. This duodenum is the part of the low intestine, and that is where we get all of our nutrients. If you have celiac disease, you get it from there. This gallbladder stores excess bile from the liver. It's going to dump it out into this duodenum with the pancreas, which is behind the stomach, right here. And it also provides enzymes to digest food boluses that come through the stomach. From the start of your mouth to the stomach, you have digestive amylase that digests carbs. You need carbs for energy. And then they go into the stomach where the bile acids and pancreas shoot out enzymes to digest the rest of the food bolus. Then if you go in here, let's see if we can see the cilia. I'm going to hide this. This is the muscle layer because the muscle layers are a different layer because they need to move a certain way. I was going to say, yeah, so the large intestine, really good in an abdominal massage because gut motility to get rid of that ileum and jejunum and mucosa-associated lymphoid tissue, part of the lymphatic system, have cleared of any pathogens, viral. It goes through this large intestine. The large intestine is attached to your thorax, abdominal cavity, and there is a part that's attached to the stomach on the transverse process. And then it goes into the sigmoid colon, which it is like a S shape, but I mean, it can be different shapes. Like the S could go like this in some people, or like this, and then to the rectum where it's excreted. The colon, interesting story. Will stay there when you have a C-section where they cut all the muscle layers. But a lot of people have said your intestines fall out in a C-section, and people don't know that. That's why they cover them up so the wife can't see it, and other people probably are grossed out, so they're not allowed to see it. And I didn't believe it at first, but it's true. These aren't attached and they fall out, but they will take their regular shape. They'll find their way. Now, it's only confined to a certain space. So if you are a female with a huge uterine fibroid, that fibroid has only been giving so much land, and it will just keep growing, and it will compressing all these structures, even the colon. And then it could start causing ischemia as it shuts off all of these little mesenteric arteries. And then also endometriosis can get in, and it can also start the colon. And then their fecal waste will be different, smaller in diameter, or just similar to like a colon cancer patient where there's a big polyp that grows on this muscle layer. I'll get to that because there's 4 layers in here. And it grows and it cuts off this motility. Each one of these little sections, it goes at a different rate, pushing fecal matter forward and down. If you have a polyp there, it has to push even harder. You can get cramping. You can also get cramping from not having enough water because your body takes water from your large intestine. Interesting story. There was a story that we learned because of that Bear Grylls guy, survivalist. If you're out at sea, you have to make yourself an enema of the salt water because that's the only way you can stay hydrated to save your life, because your colon doesn't take up any of that other bacteria or the salt. It just eliminates it, but it will take that water, and then your mesenteric system will use it to supply your body in the venous system to regulate your body. And then your kidneys will filter it out as well and give that extra water ions. All right, yeah, so let's go to that duodenum and talk about celiac disease a little bit and how malnutrition, if you're not getting enough carbs, protein, if you're eating too much fatty food, the gallbladder can get stoned, and it is attached to the liver. If that little bile duct that's coming from the gallbladder that's going into the duodenum right here, let's go ahead and hide that layer. You could see the little rugae, or I forget what they're called exactly because the rugae is actually reserved for the stomach. But these little small lines are for the digestion of the food, to take the nutrients from it. We can go in there. Let's see if we can look. Oh, Jesus. Okay. Let's just see if we can look in there. Okay. So there's a duodenal, pancreatal, blah, blah, blah. Some kind of port that dumps all that bile in it. This might be it. I'm not sure. Oh, that's the pyloric. That's from the stomach. Okay, so if we track the duodenum, we'll have to hide some stuff. Let's go ahead and hide that. That is a ligament that holds the liver to the stomach. And we can look at the gallbladder. If you eat too much fatty foods, you're going to need more bile. But it could get so impacted that your body will not be able to process all that much. So it'll start forming cholesterol stones, especially if you're not staying hydrated enough. So a lot of people, once they started those paleo diets or the Atkins diet, they started getting stones in their gallbladder. And then they had to get more surgeries to remove gallbladders in people that were shaming fats and carbs. Carbs, actually. So the fats and the proteins from the meat, yeah, people lost weight. Or what the only thing is, though, your body's going to take it from your fat, triacylglycerols. You're going to have so much fat. That's why you need to have fiber to clean up that excess fat. And they say fish oil, too. You need the good and the bad. The bad is that fat that clogs arteries. But you need it because all of our cells, every single cell in our body has a membrane for cell regeneration of a bilipid layer to prevent leakage of water. It's hydrophobic cells, and you need electrolytes to balance that transport, as well as ATP for energy and diffusion. So they had to get those removed. So if you're on a diet that restricts, your body will burn up your fat to get energy. You're going to have so much fat going through your body. Your body physically looks great. You have no fat on the outside. Your system inside is saying, like, you're choking me out, like the arteries, the gallbladder, it's getting backed up. You got cholesterol stones. You can see cholesterol stones with an ultrasound of the gallbladder, but not necessarily with an x-ray. If you do see them with an x-ray, it's because they've already calcified and there's already been blood leakage with calcium deposits forming around that cholesterol stone. Someone said they look like rabbit poop too, because they asked to look at the when they had them removed, and they said it looked like rabbit poop. I'm not sure though, because I didn't know that. But let's see if the cilia in here, cilia are like the little nose hairs, deep microscopic. They wave around trying to get all that nutrients, all the nutrients that you need, like all your amino acids or vitamins, that's another thing with the fat soluble. You need fat for fat soluble vitamins. So if you're not eating fat, then you're not getting fat soluble vitamins. And those are the vitamin D, vitamin E, vitamin A, vitamin K. Vitamin D, good for immunity. Vitamin A, your nervous system, your eyes, your skin. Vitamin K for clotting factors. E, that one is it's a helpful immune stimulant as well. They don't really say too much about vitamin E, but it's like an assisting one, it is also fat soluble, so you need that one. The other ones, like the water soluble ones, vitamin B, you see those a lot in energy drinks. You do need vitamin B12. So if you have a tapeworm that's eating everything, or if you're on antacids, you don't have what's called intrinsic factor in the stomach to work with the hydrochloric acid to break down food. And then you also won't be, and it's what makes vitamin B12 naturally in your stomach. So then you'll have no vitamin B12 in your body. And after a few years of that, a lot of vegetarians and such, or people with acid reflux that are on antacids, they will start having blood problems like anemia, and because they can't build the strong blood cells for carrying a lot of oxygen. Now let's go in here and see if we could see those little cilia. We'll see. Let's see if we hide it. Oh no, it won't let us. So there's some limitations to it, but just know there are some cilia in there along the duodenum that are processing all your food. And then you can follow it, and then it goes into the small intestines. I believe it's the jejunum and then the ileum, but we'd have to hide some stuff. Also, a lot of IBD, irritable bowel disease, or ulcerative colitis. That's our right hand side one, and then you got that's a Crohn's disease is the right hand side one, and then you have ulcerative colitis. That's the left hand side one. A lot of colon cancer is left-sided. Gastric cancer related to that is going to be dark black poop because of the blood that's getting digestion from the iron. Now, if you have other problems like that polyp, let's go in here. Let's look at the mucosal layers, because if you have polyps, you have what's called an apple core syndrome, like this section, this section. Let's say this section, you get a huge polyp, right? Well, it's going to be huge, and then there's that little lumen for the fecal matter to go through. Right here, it will be stuck and it'll be narrow. So you're going to need to get injected with some gas through your colon, and then they're going to do a CT scan, and they're going to look. It's going to be like, and they're going to look at that section. And if it looks like an apple core on that, where you have this and then that, but it's really narrow, like literally like an apple core, you need to go get like surgery to remove that polyp, and usually they have to take extra pieces. And because it's a colicky, it goes like this to move. The healing process is longer because your muscles are there. You know that. Let's look at. Oh, okay. Yeah, so it's right in there. We'll hide that layer. We start to see these folds, each one. You can look at the muscle layer, the circular muscle. Let's see if we can turn it and see if we can hide this layer too. Oh, no, because it just hides the whole thing. But you can see where the pancreas is right there. All right. That's the pancreas. Endocrine. There's our liver. All right. So lymphatic massage can help you because it will help eliminate all that extra fluid. It's a light massage. Cranial sacral, help with migraines, headaches. Also with cerebral spinal fluid, because you need that cerebral spinal fluid to pick up the brain off this brainstem. And right here, where you have the foramen magnum, that first cervical right underneath the skull. I don't know if I can unhide stuff, but this is still the meningeal, durameter of the brain. So let's look at the brain. Posterior lobe of cerebellum. We covered the covering, the cranial arachnoid. There's the dura. So it's the dura, the arachnoid, and then the pia under that, which is very thin. Those are the meninges, which get, when they're swollen, you can get even along the brain stem and the spinal cord. It'll be hard for you to flex because you'll get a sharp shooting pain. Some people get that, and that could be because their meninges are swollen, or it could also just be because they have a cyst in their spinal cord. And we can look at the spinal cord by removing this. This is the spinal cord with its meninges covering it, the durameter. Now, so you need cerebral spinal fluid. It goes around there, and then it helps to keep this brain up above the cranium foramen magnum so you don't get compression. Also, another reason that cranial sacral massage is good, it'll help stimulate cerebral spinal fluid. So if that brain is too far low, it's going to compress that vertebral artery, that first cervical nerve, as well as the venous outlet, vertebral vein. They run together. You can have swelling. It can cause vision problems, headache that leads up even to the basilar artery. So you need cerebral spinal fluid balance. You need to treat any kind of pathology that's shrinking the space in your canal from like osteophytes or whatnot. But maintaining your body with a healthy lifestyle and preventative medicine is the only way. You have to believe in the healthcare system to get checked regularly, because the only way currently to get rid of tumors, unless it's a blood tumor, that chemo, you have to have healthy organs that can shrink the tumor, is to cut it out. And the faster you cut it out, the faster you will be relieved. Because people that think their body's just going to destroy it, come to find out it does not. It just gets bigger. Like that uterine fibroid, this is a male, so they don't get it. Cutting off real estate, cutting off circular supply, nervous system supply to the gut, ending up with all sorts of gut problems as well as reproductive problems. You got to get it removed as fast as you can. Healthcare is amazing. And let's just switch to the different model, the female model. And see what here we have it, and we can add the reproductive system. And it is right over genital, urogenital. So it's mixed in there. Some reason reproductive system, that's weird. Doesn't come with a reproductive system? Oh, that is so crazy, because that is necessary. Urogenital. What's going on here? I don't know. Maybe it's just slow in the app. But the gut is covering it, maybe? No. You know, I have the $99 per year version, so I guess it's at its max right here. We don't get to look at it's low. It is there. It's very low. Yeah, so it's usually like the size of your fist. Wait, that's your bladder. Uh-huh. So the uterus is between your bladder and your anus in a female. And it can get big, start cutting off the lower colon. It can cut off this vascular supply right here if the gut gets so big. You can see the intestines. Oh, here we go. Here's the uterus right here. It's just so tiny. This is our uterus. Now, it's small, and you think, oh, how does a tumor go there? It's just designed to get really big. The thing is, it's so greedy when you have a tumor in there, but it's a benign one unless it's not, that it just takes what it wants. It just takes. But it takes the space from everything there. So you get cut off. See how this interaction right here with the femoral, the abdominal, external iliac artery and vein, and then you got a whole mesenteric complex that supplies this. This thing, the uterus, will get so big you feel like you have to pee all the time as it sits between the uterus. You might feel constipated all the time because the colon rectum is right behind it, right there, as it grows. So you need to get your regular checkups. If you feel like you need to consult with another person and you can't look at imaging to see for yourself, we have AI and we have Google. So you are so proactive in being able to take care of your own health and compare it to others. You don't even need to look for a second one. Just trust your surgery, because there are some bad ones out there. There are, yeah, because they're just not skilled anymore. They might have outgrown it. They might have injuries they're covering up because they need to survive. And then that puts you at risk. But usually there's a team, so get that removed. Any tumor you get right away, get it removed if you can, if you're healthy enough. Always stay healthy. The best way to prevent anything is to always stay healthy. Let's see, did I go over everything? Lymphatic system, gastrointestinal tract. Oh, the shoulder and the hand. Deep breathing. Okay, shoulder and hand, and then deep breathing. So the brachial plexus, if you have like a numbness, tingling sensation, burning, paresthesia, you could be having neurovascular compression starting from your brachial plexus right here. C5 nerve roots to T1. T1 is above the first transverse vertebrae, and C8 is a nerve, even though there's 7 vertebrae. Now, if you look the T1, if you're palpating and you want to know something, if you can't have access to a radiograph, the first rib is off of T1, but in a radiograph, it will actually show that it is curved up. This one's not showing it, but it will be more prominent and you will see the curves. If you palpate it, you'll see the curves. This is supposed to be the first thoracic. Yeah. And now that one, this little nerve rootlet coming from there, inferior truncal brachial plexus, that's right, forming, going around, there we go, the inferior trunk, the last nerve of the brachial plexus. And then we can go into find the fifth one. We can count and see because this is the second one because it's large. The one above it is the ring. The first one going around, the atlantal dentoid or nodding. You got the second one, the third one, fourth one, fifth one. Right below it, coming out of this nerve rootlet, is let's zoom in. So let's see if it's this one or if that's just a subsidiary. Okay, that's a meningeal branch. So it should be this one. No, that's the sixth one. Up higher. Supposed to be below it. Okay, so that's the fifth one. Supposed to be below that one though. Let's count that vertebrae again. First, second, third, fourth, fifth. Oh yeah, because that vertebral foramina is right. The intervertebral foramina is right here. So this is between the fourth and fifth one. So we trace that. The fifth one. That's the beginning of the brachial plexus. And then we go look at all that neurovascular. Okay. Vascular, you're going to get the numbness. It's like, and then the dull achy pain if it goes on for too long because it's all the muscles are losing blood supply. Now, it's right next to the brachial plexus where all the nerves are. They have myelin covering. Now, if you start getting compression and you have a tumor, that gnarly lizard in your thoracic duct growing, compressing, it's just as greedy as the fibroid tumor in the females. It just takes what it takes. And it's going to take the space here made for that. And so it's going to compress these nerve roots. And if they're compressed, it will have a stabbing pain. Some people might call it burning, stabbing. Comes and goes. You have to keep your mind occupied. If it's worse at night, that's a red flag, possibly cancer. Some tumors compressing it. So here we go. Here's the brachial plexus. There's our thoracic duct right here. Look at that real estate. Got a gnarly lizard growing, boom, 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 compress it. You get a pain in your back muscles, all those muscles that are connecting, the scalenes attaching to the first and second ribs. Got your levator scapulae attaching to the scapula right here. Okay, coming through, it's going under the clavicle in the first rib. That brachial plexus, we hid the clavicle, but we can look at the opposite side where the clavicle is and see it going over the first rib. It's also going over the second rib though. Under the clavicle, the AC joints right here, that's where the acromion process and the clavicle meet. This is where the supraspinatus, responsible for a lot of rotator cuff injuries in athletes or people that work overhand, lifting their arm all the time, repetitive use injuries. And this is the coracoid process. Now, your pec minor attached to it, going this way, like 135 degrees. You're doing the flies, boom, boom, right? Okay, and then you got the coracobrachial muscle attaching right here, assisting the arm in flexion, attaching, right? So if you have a tight brachioradialis, biceps brachius, coracobrachialis. The names are Latin and it means the coracoid process and the brachial muscle. So we can add the muscles and you can see, but look at where this brachial plexus is underneath that coracoid process, supplying the arm. You can have poor posture, can compress at the neck, the scalenes right here. You're going to have your posterior, your middle scalene, anterior scalene here, compressing. You got tight neck muscles going like this all the time, or they're short and tight because you're always looking at the computer all the time. Ischemia right here. And they're like, oh, I got pain I don't know about, right? And then all of a sudden you're going to bed, you wake up, or you're sleeping in a compressed area like this and it's shortening. You're going to have that numbness, pain, tingling. So you get a massage, stretch these out, do some stretches, neck stretches, get a massage. It's going to help lengthen those muscles, open up the brachial plexus, prevent, and the neurovascular supply, because you also have the subclavian artery and vein that run with it, I believe. Let's look. This is the subclavian artery. This is the subclavian vein. Okay, those also go between, okay, the artery and the brachial plexus are between the middle and the anterior scalene. The anterior scalene is behind the subclavian vein. Look at that space between them. And we can add the muscles right now, but I just want to get this cleared. So you can have tight scalenes. You can have a tight pec minor right here compressing it. Tight brachioradialis. Now we go to the back where it wraps around the back of the arm, brachial plexus branch. You're going to have pain, numbness, tingling in your extensors if this gets cut off right here. Now that's getting supplied, but guess what goes over and attaches it? Teres minor, pull-ups assisting for medial rotation of the humeral head and the glenoid fossa of the shoulder. And then also the teres major, which is helpful in assisting for also pull-ups and bringing the arm to the back. You can have tight lats cutting that off, so it's good to get in there. Those external rotators are very close as well. Teres minor is an external rotator. It could be from a tight serratus anterior, because the serratus anterior attaches to the inside of the scapula, right by the subclavius, and this is all the scapula. Okay, so this this acromion process, this coracoid process, all the scapula. See that scapula? Now the scapula moves with your body. Now, if you have winged scapula and it's not moving, you can also have problems with your brachial plexus, and muscle movement could be compressing blood supply and nerve supply as well. Now, some other areas for pain, numbness, tingling that would go down could be in this ulna region right here, as it goes to supply the lower arm, it can get compressed. Right, well, this is the ulna right here. But as that ulnar nerve is going under it, it's tiny, it's right here. Ulnar nerve, it gets compressed. Ulnar nerve is responsible, C7, C8, T1. Been a while. Okay, so these two fingers right here, known as tingling. Okay, also if you can't open up your fingers, that's responsible. Now, the radial nerve is what supplies the back. It can also be compressed too. Tight extensors. That is a branch of the radial nerve, posterior antebrachial cutaneous. Anything in the back of the arm is. Okay, now most of the time, from people that sit at the desk or use their hands a lot, even like bakers and they can have compression in their forearm. Even massage therapists right here, that's where the pronator teres muscle can come and be really tight right in there. And then if you go down further, right here, it goes right through this quadratus teres muscle, which can be really tight. It's actually a ligament, and it can be really tight, the carpal tunnel. Now that's going to supply your thumb and your two fingers here, half of it in the front for flexion. Now the ulnar nerve actually also supplies some of the thumb, but it's more for like adding the thumb to the body. So yeah, it's adding or adducting. So it's adding. And then flexion is this extension to that. So anatomical position, palms up. And pinky is the site of the ulna. Thumb is the site of the radius. So anatomical position, palms up. Whenever you're turning your thumb inwards, that's called supination. Whenever you're pronating, you're turning your thumb outwards. That's pronation. That's why it's called the pronator teres muscle in the forearm. Let's add the muscles and you'll see that compression. Massage can help with that. Let's start with claim 1, evidence. Okay. Support. This is the posterior scalene. It's attaching to the second rib. Oh, actually, that's the scaleneus. Yeah, they call it different, posterior scalene. And then we're going to add another muscle layer. Okay, this one is the medial it's different wording. Some people choose different Latin. There are some intertextual variations between texts, but I learned it as the middle scalene. Scalenus medius. Now look where this brachial plexus is. Look where this subclavius artery is. Okay. Now look, this is the anterior scalene. Anterior scalene right here. That could be really tight, compressing it backwards. Middle scalene can be tight, compressing backward. You got neurovascular compression right here. You can also get it from a muscle right here, the subclavius between the clavicle and the first rib. They call any of these compressions can be thoracic outlet syndrome, which they say is like an umbrella term for other compression sites that just cause that pain, numbness, tingling due to muscles being tight. So you don't need a surgery, really. You just need to get stretched, change your posture, build your muscles so that your posture is good. Okay. Strengthen what's long, stretch what's tight. Okay. That's what you do. All right. Unless you like all that inflammation buildup and healing time from being cut open. And here we go. Here is the anterior scalene, and this is the subclavian vein in front of the anterior scalene. So the vein empties out into the heart, the atrium from the top. This is the superior vena cava as it goes into the heart. And then let's go down to the other sites. Now this coracoid process right here. We have the coracobrachialis muscle. Now look where that brachial plexus is behind it, and the artery. It becomes the axillary artery once it leaves this region under the subclavius, but it was previously the subclavian artery. Now the vein, the axillary vein, because they run together, which is emptying the arm into the superior vena cava. Well, it's called a brachiocephalic vein until it gets into the chest, and it's a superior vena cava. And this brachial plexus right here, it can be compressed. Now let's add another muscle layer because we're not looking at the pec minor. And here we have the pec minor. Pec minor muscle, look how it goes over the axillary artery, branches of the brachial plexus. That's evidence for claim 2. And then we go to the back, claim 3. This is the radial nerve as it's flying, going from the brachial plexus, wrapping around the arm. Oh, it's actually the axillary one. The other radial nerve is this one. Wait, is it? Well, they're all part of the brachial plexus, but it is, where is it at? Axillary. Well, we're just gonna have to find it. It's in there. Oh, geez, that's not it, is it? Hold on. Brachial cutaneous. That is part of the radial nerve. Now, these are the heads of the triceps. Okay, so it's actually a little bit lower. So that was a musculocutaneous nerve. That's part of the brachial plexus. That is for the biceps and the shoulder. So if you're having bicep aches or weak biceps, it could be compressed right here, because look at that artery right there, and look at this connective tissue, the capsule of the shoulder, keeping the glenoid head into the glenoid fascia of the scapula in scapular movement. So it's supposed to be a 2-to-1 up to 180 degrees of flexion and abduction. 2-to-1 ratio with this, the muscles moving, the scapula in the arm movement. Yeah, that has to do with like articulations of the bone, though. It has to do with this sternoclavicular joint, the AC joint, and then just the glenohumeral joint as well. Glenohumeral joint 2 times as much as the other joints when the scapula is moving, and the scapula is supposed to go like this. Okay, so it is lower. This is the teres major. So the radial nerve, posterior brachial, right there. But I feel like it should be, we need to trace this. What is this one? Radial nerve. There we go. So that's the teres minor subscapularis. So you could have a tight subscapularis also cutting off the radial nerve. And the subscapularis actually goes under your shoulder. Let's look at it right here. And that is a medial rotator. So whenever you're moving your shoulder like this, it also keeps your the humeral head into your glenoid fossa whenever you're doing anything to push your arms out and bring them back. You need to lengthen that subscapularis muscle to decompress this, but also these top ones here in the, or the back ones, the posterior muscles, teres major, if that's really tight, that can compress this radial nerve. Radial nerve shooting down to supply the muscles of the back of the arm. You've got the long head of the triceps brachii, short head. Okay, and these are branches of the radial nerve. The external rotators, you can see a tight teres minor as well. That could compress the musculocutaneous axillary nerve, which turns into the muscular cutaneous nerve. The axillary nerve. Yeah, the axillary nerve. Musculocutaneous. Axillary is for the deltoids, biceps, I believe. And the musculocutaneous is for the biceps. And yeah, okay. So yeah, you look at those, you know where they're at, the nerve roots. And then here's the infraspinatus. These are both teres minor and infraspinatus are external rotators in people who play sports that can become injured and tight and weak. So they don't have much external rotation. If you put your arm like this, internal rotation, right? It's stretching the external rotators. External rotation, it's stretching the subscapularis. A lot of people can't stretch too much this way because of tight external rotators, which are infraspinatus, right under the spine of the scapula, and the teres minor. Now, tight compression of these muscles, I mentioned these serratus anterior earlier. Let's go ahead and look at that. We'll go ahead and remove muscles. Can we get a little glimpse of it? That's the teres subscapularis muscle. Those are rotator cuffs, subscapularis, teres minor, infraspinatus, and then here's our supraspinatus going under that AC joint right there. Okay. Now, the serratus anterior is here. That's the boxer's muscle. That's when you're doing planks, arms out, holding your body up. That actually attaches to the scapula as well. It's playing a role in motion. We'll just hide this muscle. We'll hide this muscle, the teres minor. And let's look. Let's go ahead and highlight that again. Let's hide the teres major. And then the one is the subscapularis, which does attach to the whole underside of the scapula, but there is room for the serratus anterior. It is actually right here. And it is rhomboids. All right. Those are good for shoulder retraction. We can go to the serratus anterior. So when you have that pain right by your shoulders, it's actually the medial border of the inside of the scapula. Remember, scapular rotation. That's serratus anterior, like if you're forever like this, or they're weak, or ischemia from blood supply, neurovascular blood supply being cut off. It's the serratus anterior right there, protracting your arms. Maybe poor posture. Maybe you got knots from it, always holding yourself up. So here's our scapula, right? Okay, actually it's the fascia of the scapula because it's all covered right here. Oh, it does say scapula. Okay. Now here it is attaching a broad muscle, serratus anterior, and it's reaching around to the first 9 ribs. And you can look at the compression sites. It's under the brachial plexus. Okay. And the serratus anterior, they call salt pneumonic because it's a long thoracic nerve that supplies it. It can lead to wing scapula when it's injured. And what happens is this part of the won't really be supplied muscle. So it will wing out whenever they're just flat on their back, or if they're up, it wings out because their serratus is injured. It's not like holding it like it should. And so much battery. Dang, that sucks. Okay. It uses a lot of battery. And then that's also a compression site for nerve tingling pain and injury above it. So if it's too tired or the blood supply injured, where can it be tight at? If the scapula is not rotating like it should, that can lead to postural changes as well, because it'll be winged out and it can compress these nerves here because it will drop whatever nerve this is. Supraclavicular nerve, that I believe that's to the, doesn't ring a bell. Maybe it's the supraspinatus clavicular. All right, and then of course a lot of people get knots in here. Posture. You got to strengthen what's long and weak. If you're like this all day, those back muscles are long. You need to do more. Okay. If you're maybe you're like this all day, slouching like this, your serratus anterior are weak, so you need to do more planks and pick them up. You need to be more in line for the females. So your and your AC joint should be aligned so that your nerve roots and vascular structures can have stretches, resistance training, weightlifting, massages all help with that, massage and body work. So thanks for joining this Q&A. Let's talk about deep breathing. So if you do need some deep muscle work done and you have knots here and you're not used to it, you don't have to stress yourself. Right? You don't need all that work, especially if you don't have the tolerance for it and it's scaring you. You'll be so sore the next day. And another reason you're going to be sore is because all of these bones, like these ribs in here, they have a periosseous lining. If you don't have enough of this dense tissue made up, fibrosis, where it's really thick and you can't feel anything because of all of the nerves and everything there, you feel pain because of all the ischemia and cut off neurovascular. Your ribs right there, your ribs are gonna get bruised, and that is a fluid from going over the periosteal bone lining of the ribs. And believe me, there's some people that think their back is like so tense and tight, and it's not. Their muscle layers are narrower than my finger right here, and there's some people layers are as thick as my forearm, and they don't have enough pressure. So you might be having a lot of pain and think you need more pressure because you don't feel anything, but you're going to be in the worst pain ever if you don't have anything and you got an elbow going right over every single one of you right here, and a pair of lining in there. So it doesn't go into much detail whenever you do that because you have to hide the whole thing, but the bone does have a periosteal lining. It has a medulla inside, blood, red blood cells, white blood cells, lymphocytes. So that is going to get bruised. You're going to feel pain. Typically, a stress fracture. Okay. Now, if you do have a little bit of pain because it's a huge knot, and you need to get it broken down because it is just totally compressing this whole brachial plexus right here. A lot of people get it from technology right in here because they're like this all the time where their head's right here or right here. Every 10 degrees you go, 10 more pounds of pressure right here, keeping your head up. Well, you breathe through it. You breathe. You can do deep breathing through your nose, out your mouth, or you can take a deep breath. 4, exhale 4 or 5 or 6 lung capacity is, and focus on that because you need it, and that's going to break down your knot. Now, that's not going to do anything to your bones. You won't get a stress you will have a low-grade muscle strain, and you will be sore for a few days afterwards if it was done right. Unless you're used to it from like working out all the time, but it will relieve those signs and symptoms of neurovascular compression. Vascular compression, the arteries, the veins not doing enough, lymphatics not doing enough, and nervous compression, the sharp shooting pain. Neurovascular is like the little achy from the burning pain, stabbing pain, that's from something else. A boring, deep pain you can't get rid of, that's viscera. The stabbing, burning pain, the fascia, like this, the deep fascia right here. So where the lymph nodes are, not pulling up enough fluid, just long-standing stretch receptors in the fascia pulling off the muscle, the myofascial off the muscle. Fluid in there, burning sensation wherever each one of these little fascia. Abdominal massage, you see this. Here's the fascia shared with the transverse obliques, and then also the deep muscles. What's that in the fascia? Deep fascia right here, helping to remove fluid retention. Any gut motility issue can also be backed up and lead to that mesenteric complex. Compression, uterine fibroids compressing on the gut, menses for bleeding out too much, pain, lower back pain. All right, and then I believe that's it. So yeah, breathing. All right, stay tuned for the next one. If you like this video, hit like and subscribe. That's it for today. Schedule your next massage. Have a good day.